Today we are going to demonstrate the injection of platelet-rich plasma, that is PRP, in the knee joints. And along with that, in one knee, since the changes are grade 3 osteoarthritis and patient is having pain, so I will be injecting platelet-rich plasma and hyaluronic acid, that is monovisc injection in one knee, and in the other knee I will be injecting only PRP because this knee has grade 2 osteoarthritis changes. So first of all, it is very important to lay the trolley and take things in a absolutely aseptic, using all aseptic precautions and absolutely sterile environment. The steps involved in the preparation of PRP include taking the patient's blood, whole blood, and separating it in a specialized machine, that is the centrifuge, into platelet-rich plasma. The blood gets separated into three components, like you can see in this test tube. That is, lower down you can see the RBCs settle down. In between there is the gel, and on top of it you can see the transparent yellowish fluid, that is the plasma. The plasma again has two components, the leukocyte rich and the leukocyte poor plasma. For injection into the joint, we always inject the leukocyte poor part, whereas into the ligaments and tissues, we try to inject leukocyte rich plasma. So absolutely sterile conditions have to be used, and this plasma is the upper part is the platelet rich plasma, but it is at the same time leukocyte rich plasma. So what we do is take the upper 2 ml of platelet rich plasma in a separate syringe, and the lower part, after proper mixing, we take the last part, that is the platelet rich plasma, which is poor in the leukocytes. Here you can see this amber colored fluid, that is the platelet rich plasma. This is going to be injected into the joint space. Now this is the monovisc injection, that is hyaluronic 22 milligrams per ml injection, which is available in a pre-filled syringe. They are available from various companies. I am using this particular one, but there are a lot of companies marketing hyaluronic acid, and this is also known as the grease in the local language, when the people say the grease in the knee joint. So this is a pre-filled syringe. It is an expensive injection, and that has to be injected at 6 months interval. You can't do it before 6 months. So first of all, we have to clean the knee joints properly with betadine, and under all aseptic precautions, we have to give the intra-articular injection. So the first step is localization of the joint space. So when you say localization of the joint space, we try to see, when you say localization of the joint space, we try to see the best possible place where we can give the intra-articular injection. So then, after identifying the joint space, we give a local anesthetic so that the patient does not get pain at the time of the procedure, and we want the patient to be absolutely comfortable. So this is the only injection that causes pain, otherwise the patient will not get any pain, right? So after this, what we have to do is take a 18 gauge Venflon and inject and introduce the 18 gauge Venflon into the joint space and check it under the C-arm again. There you can see the Venflon into the joint space, and I'm going to inject, and now I'm going to inject the dye just to check the good dye spread into the joint, that I am in the joint space. So this is the dye. This is a water soluble dye, and position of the joint space, what we do is we inject the Hyalase injection into the joint space. So this was the knee which required this Hyalase injection because this has grade 3 osteoarthritis and patient does have pain. This is followed by the platelet rich plasma, which is poor in leukocyte. and we do not inject any local anesthetic after that. So the patient has to be explained that the patient might get little bit of pain and there might be flaring up of pain in the post-procedure time for at least 3 to 7 days, but the patient is not supposed to take any anti-inflammatory injections following the procedure. Under all aseptic precautions, the injection has to be given. So the knee is cleaned with betadine, the aseptic and antiseptic conditions, and then the joint space is localized with the help of a fluoroscope. After localizing the joint space, we give the local anesthetic injection. So this is the injection of local anesthetic which we are giving so that the patient doesn't have any pain during the procedure. So this is how we give the local anesthetic, and after the effect of the local anesthetic is there, we take a spinal